One of the most disheartening and saddest thing is to see a friend, a loved one, and a relative suffer from stroke and heart related conditions. The treatment process and financial aspect of these conditions are very demanding and draining. These are diseases that no one will ever wish for, even his or her enemies. But from Ghana Society of Cardiologists, many young Ghanaians are getting stroke, the working force, the future of this country. This is the Lab Doctors channel on YouTube. I'll entreat you to subscribe to this channel, like our videos, share our videos, comment so that we can bring you more health information around the globe and health education as well. The Vice President of Ghana Society of Cardiologists, Dr. Francis Agyekum, has indicated that there is a worrying rise of stroke and cardiovascular diseases among the youths of Ghana. He attributed this to the lifestyle and general lack of exercise. So, this is my question. Though the Ghana Society of Cardiologists have associated this to lifestyle and the lack of general exercise, which is very true, but my question is, could it also be as a result of the COVID-19 pandemic and then COVID-19 vaccination and health risks that are associated with COVID-19 vaccination? I am saying this because the recent largest COVID vaccination studies conducted by World Health Organization suggested an increase of heart-related diseases and stroke, which is linked to COVID-19 infection and its vaccination. So please, if you have encountered any abnormal heartbeats, please let me know from the comment section. So let's talk about stroke. Since Ghana Society of Cardiology mentioned about stroke, stroke occurs when there is decreased supply of oxygen to the brain. This occurs when a blockage or bleed blood vessels either interrupts or reduces the flow of blood to the brain. When this happens, the brain does not get or receive enough blood, nutrient, or oxygen. And by so doing, the brain cells start to die. Let's get to know how stroke happens. Please, this very topic is very vital and very important due to the information reaching us from Ghana Society of Cardiologists. You need not to joke with this topic. Note that stroke is a disease of the brain. Also remember that brain is the source of our thoughts. It controls our movements. It stores our memories, emotions, and language. The brain also has other important functions within the body. For the brain to function properly, it needs enough or adequate supply of oxygen. Note that your arteries are responsible for supplying your brain with oxygen rich blood. And so, if something happens to block your arteries, or if your arteries bleed, it interrupts and reduces the supply of oxygen rich blood to your brain. And when this happens, your brain cells start to die. This is how stroke happens. There are three main types of stroke. We have the ischemic stroke. This happens when your blood arteries are blocked or narrowed. We have the hemorrhage stroke. This happens when blood leaks into your brain. And we have the transient ischemic stroke. This happens when blood flow to parts of your brain is inadequate for some period of time. We are moving to the next important point, but before then, if you don't want to get stroke, then you need not to miss these points. Knowing them will go a long way to help you to know your do's and your don'ts. So this brings us to the causes and risk factors of stroke. January, each and every type of stroke has its causes and risk factors, but these are the general ones. First one, I would say, is if you had COVID-19 vaccine. If you took the vaccine, if you were vaccinated, you have the chance of getting stroke. So be very extra careful. Our next point is obesity. If you are overweight, please try as much as possible to exercise. This will go a long way to reduce your risk of getting stroke. We have high blood pressure. If you are a patient with high blood pressure, then you need to follow up your medication as prescribed by your doctor. If you have any heart-related disease, you stand a chance of getting stroke. We have diabetes. Diabetic patients also stand the risk of getting stroke. High cholesterol level. If your cholesterol level per your lab test indicates high per the reference range, you stand a chance of getting stroke. So the little advice I will attach to this is that if you are getting abnormal heartbeats, sudden abnormal heartbeats, please, you are entreated to go and check your cholesterol level. This particular sign is very rampant nowadays. And so if you experience it, please take action now. Family and then personal history of stroke. There is a possibility of you getting stroke again if care is not taken. We have the use of illicit drugs and smoke. We also have excessive intake of alcohol. These are causes and risk factors of stroke. I hope this will go a long way to help you so that your name wouldn't be added to the youths suffering from stroke in Ghana. So kindly stay safe and stay healthy. Please, I will encourage you to subscribe to the Lab Doctors channel on YouTube, like our videos, kindly share our videos and comment for more health information and education around the globe. Till we meet again, bye bye.